All right, so let's talk about wrist and elbow soft tissue mobility. Let's say that, we've done those stretches, we've worked on that mobility through just passive stretching, the elbow gapping techniques, it just wasn't changing any of our pain or our range of motion. So let's show you how you can do some of your own soft tissue work at home. So let's say that I am limited with with wrist flexion. And I've done the stretches, it's not really helping. What I would recommend using is either some type of lacrosse ball, some type of a tennis ball. The more firm of an object you use, the more pressure it's going to be, the more discomfort it may cause. But I would recommend, there should be a little bit of discomfort. I know everybody's pain levels are different for everybody, but I would say no more than a 4 out of 10 on average. We want something that we can tolerate, but also make sure that our body is breathing. If we're not breathing and you're getting a massage or you're using the tennis ball as I suggested, and you're just grinning and bearing it and you're not breathing, your body's nervous system is going to continue to say, this isn't safe, we're not okay, and it might actually heighten up your pain response. So make sure we're able to breathe through this, because the goal of using and doing your own soft tissue mobility is to find spots that are uncomfortable, because that's a sign that we should be working on them. It needs a little bit of love and attention. So wrist flexion, how can I improve that? Muscles on the palm side here, they are all responsible. They go through the wrist joint here, attach at different spots in the wrist, into the fingers and thumb. They start up here. They're responsible for flexion. So we're limited there. Not getting any luck with stretches. What we do is, let's take a ball, let's get down on the forearm, and let's just go back and forth, and let's go hunting, okay? And let's say, right there, I'm feeling a some discomfort right there, going back and forth. I'm gonna continue to work that spot, okay? I can just feel like a big lump or big guitar bass string or something when I go over that. It's a little uncomfortable, and I'm gonna keep doing that, okay? I'm gonna spend a couple minutes going over that. And a good sign is after a couple minutes, you start to notice the discomfort, the pain goes down, or you should be able to push more into that ball. And if you notice there, I'm using my other arm to help that. Another option is, let's say you're going back and forth between a tight knot. What you could do is let's say we just find that knot, we focus on it right there. Yep, that sucks. And I'm gonna push in on that, and I'm just gonna flex and extend my wrist to kind of use a pin and a stretch technique here. Kind of like a modified ART technique that some of you, if you've been in therapy or in some type of rehab care, the practitioner might have done this on you. That would be a great way to improve wrist flexion. And I would spend a couple minutes doing that, 2 to 3 minutes, and then just compare, right? If I notice a difference or an improvement, it's not hurting when I'm doing activity, we know it's something that you need to continue to do. The other thing that's cool about working that side of tissue is that it also, this palm side, this is gonna help for pronation, okay? So there's a muscle right here, your elbow, hopefully you can see that right through here, that attaches to that medial part of your elbow, called your pronator teres. That's gonna be responsible for turning you palm down. So focusing right up by the elbow joint, that medial side here, you do that same kind of thing, that's gonna help with pronation as well. So now, I don't know why I jumped up, I have to go back down anyway. Now, let's say wrist extension was an issue, painful, stretches aren't helping, we're not seeing any improvement. We'll just do the same thing we just did, but we'll go the opposite side. So now we're gonna go the back side of the hand, because all those muscles that extend the wrist and the fingers and the thumb, they pass through here, have different attachments at different portions of the wrist, different portions of the fingers, thumb, but they all start up here at lateral elbow. Some of this is referred to as tennis elbow. So, same thing here. Use my other hand, push down. There's a spot right there. I can go back and forth. I can go any direction over it. Make sure I'm breathing. Some discomfort's good, because that's a spot I need to work. Or I could pin it down. Yep, that's the spot. And then I'm just gonna flex and extend my wrist using a pin and stretch technique. And I would do this for a couple minutes. If for some reason you start to go numb, tingling, take a little bit of a break once you feel that, because there are nerves on both sides of the forearm there. It's not a bad thing, doesn't mean you're gonna develop any carpal tunnel, cubital tunnel, anything like that. Just listen to your body. Once you start to experience that, back off, go back to it, try to accumulate 2 or 3 minutes of that, okay? Good news with working this side is there's a muscle called the supinator. Attaches right through here, right by that lateral elbow, just around it here, just off to the side, maybe just guess you could say slightly inferior to that. Down through here, I'll show you. It's kind of, this is my elbow point here. Okay, this is that lateral epicondyle. You can push in on somebody who's tender. That supinator is going to kind of be between these two bony prominences right here. And then I would just focus on having the tennis ball go back and forth. That I can put that on a bench, whatever, roll it out, I can. And that's going to help me also with supination, which is great. You might even notice that by just working the whole forearm too. So last two things, we went through our forearms, we went through our wrists. Now let's talk about how can we improve elbow flexion. So the bicep, which is right through here, is going to be responsible for elbow flexion. It's not its primary action though. The bicep's primary action is going to be actually your shoulder flexion. There's a muscle through here when our thumb's in neutral, which what I would say is like I'm not palm facing you, not palm away, but thumbs here, forearms in neutral. There's a muscle called the brachioradialis that's main job is for elbow flexion. So what I would do is, I'm not going to lie down, but you could lie down. And what I would do is I would take that ball, foam roller, whatever you want, put that bicep on it, go up and down. You can go back and forth, find those spots. Okay, that's what I would do. I would do the same thing there. And I would just be working that spot that's uncomfortable, wherever you're feeling some discomfort, pain. Remember, the pain should start to diminish after a couple minutes of doing that, 2 to 3 minutes of doing that. And then for elbow extension, tricep is going to be responsible back here for elbow extension. And this one's a little bit easier to do. We can do it on the wall, we could do it on the bench, whatever works. I'm just going to do it on the bench here. I'm going to just stick that ball above, and I can work down at the insertion down by the elbow. I could go up into the muscle belly. Oh yeah. Yep. I could even extend my arm there. Whew. Yep. Oh man. I'm gonna have to work on that one. I don't have time to work a couple minutes on this video though, but those are some strategies that you can use, do your own soft tissue mobility to improve your elbow extension. I gave you all the ones for the wrist flexion extension, forearm rotation, and elbow flexion extension.